hello, so that we know it's you and people can reach out to you directly, because it can be a bit difficult to find in the meetings and all this. Are we good? So, the next session is very exciting. It's about access to PrEP for sex workers in Europe. We have 3 panelists and somebody joining us on video, who sent us a little video. They are very, very busy in Zurich, running around, so they couldn't join, but they'll send us a little video. So we don't really have a chair. Well, Agatha, you wanted to chair? Agatha Juban. Agatha is a former ICRC policy officer, so lots of the reports you see in the back were written by Agatha, who is also doing amazing work in Poland, activism, academia, and is a really good friend. So just go sit down. Okay, thank you.
Hi, everyone. So we are now having an amazing panel, I was looking for it, about sex workers' access to PrEP in Europe. And I think we will start with Fernanda, that will tell us about amazing ICRC ESWA, research on access to PrEP in 12 European countries. We're going there?
Yeah. Is there a micro there?
No.
Okay. Thank you. I'm sorry, I need just a few moments to prepare all this stuff here. Well, good morning to everyone. Thank you so much for being here today. And of course, thank you, ESWA, for the opportunity to let me lead this research together with Mirko and also present this research here today. My name is Fernanda. I'm a PhD researcher based in Portugal, and together with Mirko Costa Curta, we are leading this research about the access to PrEP by sex workers in Europe. That is going to be the object of my presentation today. I am an immigrant woman, an immigrant cis woman, and Mirko is also a PhD researcher, just like me, and he is an Italian cis gay man who is also a sex worker. So this research was designed and created based in the community, following the community methodology of exploratory research. So we are talking about PrEP. It was up to me to talk, to say what PrEP is. I'm going to be very brief. PrEP is the pre-exposure prophylaxis that is, in general, a medicine that is taken to prevent getting HIV. PrEP is highly effective for preventing HIV when taken as prescribed. It reduces the risk of getting HIV from sexual intercourse by about 99% and around 74% of efficacy if you are taking about drug use injection. Of course, the prescription of PrEP has some steps, important steps that are recommended in several documents by World Health Organization, by ECDC, and so on. I will not stick to that because the intention of this research is more to talk about the living experiences of sex workers by accessing PrEP, accessing this way of prevention. And I'm going to stick to the sociological and the other structural determinants of health. So, since 2015, World Health Organization recommends PrEP as an effective tool. And according to the ECDC, PrEP is available in 38 out of 55 countries in the European region. But of course, that we cannot guarantee that in 38 countries out of 55 that PrEP is available for sex workers. And we are going to talk a little bit more about that in this presentation. So ESWA decided to conduct an exploratory research to understand what is the effective access to PrEP by sex workers in Europe. And we developed this research that is divided in 3 phases. The first phase was a literature review that we reviewed around 200 documents and make a thorough analysis of 50 documents that included official reports, scientific literature, and so on. And we decided that as an exploratory study must be done because we don't have a lot of references and literature about sex workers' access to PrEP that is different. There is a population with a lot of singularities. We decided for in-depth interview. So we interviewed in the last 6 months 46 people. These 46 people were trans sex workers, cis women who are sex workers, trans women who are sex workers, cis men who are sex workers, also service providers and service providers and stakeholders. All of them represent 12 countries that are Armenia, Austria, Germany, France, Italy, Netherlands, Poland, Portugal, Sweden, Switzerland, Turkey, and the UK. And we are now, we have already worked in this data, and we are in the moment in this research of producing the final, to produce the first drafts of the final reports for community validation. So our main questions were, which are the conditions that influence the access to PrEP by sex workers in Europe? And which is the gap between the official discourse on country PrEP implementation and the real experiences for sex workers? I will give just an example for this second question. We have countries where PrEP is free of charge, but for nationals. If you are an undocumented migrant, you need to pay for PrEP. So you cannot say in a sex worker perspective or an immigrant background perspective that it is a country that offer PrEP free of charge. So we have this official discourse that here in my country PrEP is free of charge, but we have the real experiences of sex workers and the entangling vulnerabilities that these population face and how it is perceived and constrain the access to PrEP. So we have always this in mind, that ECDC states that an effective PrEP program is one in which people are adequately identified, are offered PrEP, and then received continued support to use it as needed. So we decided to look at several variables, and that is the beauty and the complexity of this study, that we were trying to understand the influence of the national legal framework of sex work in each of these countries, the influence of this legal framework in accessing PrEP. For example, in Sweden, where we have client criminalisation model, and France also, if this is an important variable that challenges the access to PrEP, or in countries where sex work is not completely criminalized, in regulated frameworks, just like Germany and the Netherlands, if this framework influences the access to PrEP, and so on. Also, the national policies or guidelines for PrEP in each country. Most of the countries has national guidelines for PrEP. Some of them do not even include sex workers in these national guidelines because they emphasize the group of cis men, and other trans and non-binary people that were assigned male at birth, because they are considered more important population that they can get use they take more advantage of a PrEP prevention treatment, and we can talk about it later, of course. And so the national policies sometimes include sex workers also, but if you are a cis woman, and even when you disclose your occupation saying I'm a sex worker, I want to have access to PrEP, maybe your physician can say to you, no, for you it's better to use condom than PrEP, and so you have your access to PrEP denied as well. So the national policies influences a lot the accessibility of sex workers to this treatment. The other variable, very important, is that sex workers are not a homogeneous community, and of course we know that. So cis women, cis men, and trans sex workers have, all of them, different experiences regarding the access to PrEP. I have had an example for you. And also other specificities of this particular group of sex workers, that is the migrant background, the people who use drugs, that people that are engaged in chemsex, and other specificities. So the study wants to explore, not exactly produce straight conclusions, but to explore and create lines of further research considering all these variables. So we have grouped these countries. As I said before, it is difficult to create criteria for grouping the countries. Usually in the literature, they divide countries in not reimbursable and reimbursed PrEP, where they state reimbursed PrEP for the patient or the client, and the others where there are no national policies, or you can only get PrEP in private settings, in private medical settings. But for us, it's a bit difficult, as I said, to make this division. But I think it's a stable division to divide by not reimbursed or reimbursed PrEP, if we consider that reimbursed PrEP is in a framework of a kind of mediation by public policies in providing PrEP at a low cost for the patients. So here in these countries, Armenia, Poland, Turkey, Austria, PrEP is either more expensive, or you can maybe you can afford the medicine. It's not that expensive, just in case of Poland, but you have to pay for all the medical appointments, the lab tests, the STI prevention, and everything else. So even between these countries, there are a lot of different specificities that we are exploring in the research. So my idea is mainly present to you some findings, and maybe we can discuss them a little bit. So I'm going to stick to that. I think Kai yesterday was talking about her experience, that she said that she wanted to be eligible for PrEP, and the physician said no, that she was not a risky group. And so World Health Organization has issued a document where it states that it is very important in PrEP programs to respect the patient request of accessing PrEP, that patient must know better which is his or her condition, and it needs to be taken into consideration. And no country reported that they respect this consideration of the patient request. PrEP is more than prevention, is a source of confidence. We have some stigma related to PrEP that if a person wants PrEP, this person wants a more sex-free life, and it is okay. So it is a source of confidence, and we can discuss the morality of this decision and so on. For cis women, PrEP is unavailable unless she discloses her activity, and sometimes even when she discloses her activity as sex worker, the PrEP is denied to her. So only one respondent from trans and cis gay community reported to have disclosed its activity, because trans women and gay men have access to PrEP not because they are sex workers, but they are included in other risky population. So they don't have to disclose its activity to have access to PrEP, but cis women in general does. So it's very important that we look at the situation of the inaccessibility of cis women to PrEP, because this is the group among sex worker population that are more, that having more trouble and face additional barriers together with undocumented migrants. Also, undocumented migrants face additional barriers and bias when recurring to PrEP. There are a lot of studies that are being conducted with service providers, where service providers saying things like they do not recommend PrEP to migrants from specific regions of the world because they think they do not understand the program and will not adhere to the treatment. So this is a bias, this is xenophobic, and undocumented migrants face this additional barrier. PrEP services usually are not integrated with gender-affirming care for trans sex workers. They are not usually integrated with other social responses as housing, social service, drug consumption support, which defies and challenges the adherence to treatment. In countries where PrEP is more expensive, sex workers report that they say to their physicians that they are on daily PrEP, but they use event-based PrEP to share the medication with their peers, or even people that live with HIV that has the medication freely usually defies its treatment of taking the pills every day to share the pills with other people, with other peers that need to be on PrEP, but they do not have economic conditions to do so. And even in countries where PrEP is free of charge or at low cost, we have long waiting lists, and services are concentrated in larger urban areas. So we cannot ensure that this is access to PrEP if it's not to everyone. There are some other, as we can say, more societal consequences of these sorts of arrangements, where in countries where the PrEP is not refundable and not or is at high cost, PrEP is seen as something for wealthy white gay men, and it's not considered a right, and it's not in the agenda of activism to fight for the implementation of PrEP. But in countries with free programs and larger programs, where sex workers have greater access but not full access, we can say, because of the things that I explained before, we can see that the community is more educated about HIV. They know all the process of PrEP. They know about lab tests, follow-ups, medical appointments. They are more informed in general, and they play a crucial role in engaging peers to start and adhere to the treatment. We have the majority of our respondents say that they started PrEP because it was recommended by a peer, not exactly by a doctor. So the peer education and the peer relation, plays a crucial role in sex workers' access to PrEP. Also, sex workers reported that they educate clients about HIV, STI, and PrEP, bridging a gap of misinformation due to the poor sex education in the countries. A lot of people, not only sex workers, but also stakeholders, talk about that the general population doesn't have access in their countries to sex education programs in schools, during their lifetime, and the contact with sex workers provide this education that they don't have. When a client, for example, see the pills of PrEP and asking a sex worker if she lives or he lives with HIV, sex worker tells about PrEP and say what it is and invite sometimes the client to adhere to the program as well. So just to finish, I have some quotes for you. They, trans sex workers, this is from Turkey, a country, the first one is from Turkey, a country where PrEP program is not well developed. They don't know much about sexual health like PrEP and how to protect themselves from sexually transmitted infection. And since the poverty is increasing, most of them are focusing on earning more money. And so this person talks about a higher level of drug addictions. And especially in the last 5 years, it has increased crazily. With the pandemic, it has increased even more. And so they are mixing drugs with every kind of other drugs. They are open to every kind of unprotected sexual activity. They are also at risk to physical violence by their clients and their peers. In Austria, cis women who are sex workers say, even if I pay, they don't want to give me even an HIV test. Never mind about PrEP. My gynecologist is focused on like babies. They are not focused on preventing STIs and so on. This person specifically is an informal sex worker. And in regulated countries, we found a lot of people a lot of women that are informal sex workers because of the regulated environment, and it has a lot of specificities in terms of accessing PrEP. This is gay man from Germany said, I experienced a lot of discrimination when I first took PrEP. People were saying it was because I want to have a certain lifestyle. A lot of colleagues who offer chemsex prefer to take PrEP rather than use condom because it's a lot easier to control. In Sweden, these trans sex workers say, when you disclose your occupation as sex work, you have to put up with everything from being seen as dirty to being encouraged to leave the sex trade. And you have to listen to them telling you that because of what you do, you are at high risk. And that even though you're on PrEP, you should stop having unprotected sex. So it comes with a lot of judgment because of the stigma around sex work, I think. And this key informant in Portugal say, the other difficulty is that anyone can get PrEP, but of course, if you are away from the big cities, you are not living in Lisbon, in Porto, in Braga, many sex workers do not live in the big urban centers. And many are always on the move, so changing from city to city, sometimes leaving the country, makes it difficult to adhere to the treatment. I don't know if my time is, okay, I'm finishing. None of my friends are on PrEP in Poland. None of my friends, none of the people I know, none of the people I met through outreach. I know no one who does it. It was a sex worker in Poland that tells us that. Also from Poland, I mean, we are so far away that this is like a luxury. When I think PrEP, I think about middle class and higher middle class, white gays, you know. This is like Whole Foods products. So, Just to finish, this trans sex worker from France, and one time my client is coming, he sees it, the medication, and says, oh, you are sick with your HIV. And it's getting outside quickly. He doesn't wait for me to explain. But after this one, always before the client, when I take it, sometimes client at a home, I have to be sure he doesn't see the PrEP. If he sees it, the stigma, don't forget, when we take PrEP, we have so many stigmas from people who don't know what PrEP is. So these are one of the codes. I'm open to discuss it if we have time here or during the breaks and so on. Thank you so much for hearing me. And that's it. Thank you.
Thank you so much, Fernanda. And the good news is that this report is coming soon in February. So. And just follow ESWA website and social media, you will find it. And now, as we were talking about mobile sex workers and challenges for migrants and mobile sex workers, we would like to introduce, oh no, Benjamin is online. We playing Benjamin now or at the end? At the end. Okay, so right now we would like to invite Ed, who is, as you know, a wellness team member today. And Ed will tell us about the injectable prep for sex workers and about the amazing service provision in the UK that was already advertised yesterday. The microphone is yours.
Okay, I have a confession to make. I am definitely not an expert on injectable prep. I'm sort of coming at this very much from the perspective of being an outreach worker, looking at the kind of real-world impact of access to PrEP for sex workers. We do have an actual expert on PrEP here from Vive Healthcare, who he and I had a discussion before my presentation, and I did have some slides, but I've decided to drop them because quite a lot of the information on there, as it transpires, was either out of date or inaccurate. And I would never put out there misleading information. So I'm going to drop my slides and just go with it. Oh, it's beautiful, isn't it? Look at that. Lovely. Oh, hold on. Yeah, just as an introduction, I'm Ed. I'm an outreach worker for a sex worker support service called Open Doors. We're based out of Homerton Hospital Sexual Health Services. And I'm also the PrEP lead, so it is my responsibility within our team to try and increase the numbers of sex workers that access our service on PrEP. I'm also an independent sexual violence advisor, so ESWA in the UK context. That means that we support victims of sexual violence through the criminal justice process if they want to report. And I also run support groups for sexual abuse survivors and chemsex users as well. Just to kind of say where I'm coming from, I'm not a sex worker, I'm an outreach worker, that's my background, I'm an ally, that's why I'm here. I'm here to listen, I'm here to learn, and I've already learned a hell of a lot since being here, and I feel very privileged and lucky to be here with you all, so thanks very much. A little bit more about our service. It's been around for about 20-25 years. There was a lot of activity identified, street-based activity identified in Hackney in East London, and so there was identified to be a need for a dedicated sex worker service. And so we provide, we do street outreach, we have drop-ins, we provide housing support, we'll work around benefits, access to mental health and drug and alcohol services if that's what people need. Probably a good call. And so, given that, obviously we are a service that is available to anyone involved in the sex industry, but on a long-term basis or on a day-to-day basis, the majority of the sex workers that we do work with on that basis tend to be street-based, tend to have higher levels of addiction and debilitating mental health issues, and so that's just to sort of provide the context. But obviously we are a service available to all sex workers, and we also have direct access to our sexual health clinic, which means that, and I think it was, sorry, I think it was Marin who said yesterday about Dean Street in London and about them sort of talking about gold card services for sex workers, and it's a similar thing in our service. Basically, if you're a sex worker and you sort of you have contact with us, we book you the appointment, we deal with reception, we deal with all of the kind of admin, just tell you where you need to be. We also have dedicated sex worker clinics as well, so that to make sure that there's no risk of anyone being shamed or outed. People can be anonymous. And it was quite humbling listening to the experiences of some of the panelists yesterday about healthcare access in Europe, and it was really quite shocking. And I think quite commonly in the UK, we just sort of think that everything we do is terrible, and that we're massively behind the rest of Europe. And turns out in some cases that's not the case. Thanks. I'm just getting help from everyone right now. We're all getting involved in this. No, exactly. So just a little bit of background with the injection. It is known as what's available as long-acting cabotegravir, and it is a bi-monthly injection. So it's once every 2 months. And so 6 shots a year. Obviously, much simple and just much easier to manage than daily PrEP. It's manufactured by ViiV Healthcare, manufactured by ViiV Healthcare, and there are a list of countries that have already approved it. It was first approved by the FDA in the beginning of 2021, and since then we have a few countries that have had it approved: the US, Australia, Zimbabwe, South Africa, Malawi, Botswana, Brazil, Philippines, Zambia, Malaysia, Peru, and Nigeria. Apart from the high-income countries in that list, everyone else doesn't have to pay for it, so it's much easier to be rolled out in these places. Also, in September 2023, the EMA, so the European Commission, actually approved it, and so now across the rest of Europe, it has now officially received approval as well. There are 15 countries that have submitted and are awaiting approval, including most recently the UK as well. So in the UK context, we're currently awaiting approval for injectable PrEP. Unsurprisingly, it's the UK government that have been meeting ViiV's sort of discussions and negotiations with indifference. And so it is being held up, but hopefully we're going to start making progress with that soon. And thankfully in the UK, daily PrEP is widely available. And certainly in our service and lots of other clinics, it is easily accessible for sex workers. There is a pathway for application to ViiV in the UK to get funding for injectable PrEP on compassionate grounds. And that takes us to a case study of one of our clients that we work with. So I have a guy who is amazing, one of the most sort of, interesting and incredible people that I've ever met. He's also incredibly troubled and has a very typically sort of sad story behind him. He is a cis male GBMSM sex worker, grew up in care, moved through the care system, was sexually abused in care, very, very distressing and traumatic childhood. As a consequence, has developed lots of different mental health issues. He's suffers with PTSD. He's diagnosed emotionally unstable personality disorder, ADHD, and autism spectrum disorder as well. Unsurprisingly, he's been a chaotic drug and alcohol user for most of his adult life, daily uses of alcohol, heroin, crack, and as a consequence of all of this, has spent most of his adult life in and out of cycles of homelessness as well. For the last year that I've been working with him, he has been rough sleeping or in and out of mental health wards, and because of his behavior towards residents and staff members as well, he's been banned from pretty much every single accommodation service in Hackney as well. So even when he is able to engage and we are sort of, in a position where we can get him into accommodation, it's very, very difficult. By his own admission, part of that also is him sex working in order to get into accommodation. And so by his own admission, he regularly has unprotected sex with multiple partners because he just feels that when a punter refuses to use a condom, there's just nothing he can do about it. He doesn't have the power within him to be able to refuse because of his circumstances. And so in terms of contracting HIV, he's pretty much as high risk as you can get. And daily PrEP, although me and my colleagues have tried several times in order to try and get him on daily PrEP, even when he is in a position, when he's sober enough or in a sort of stable enough position to engage, and I can actually get him to the clinic, which I've managed to do a couple of times, he can't keep hold of 3 months, 6 months worth of daily PrEP for longer than a couple of days before it's all gone. So it's just not an option for him. So we did make an application for injectable PrEP on compassionate grounds. Unfortunately, this was rejected. And part of the reasoning for the rejection was because of ViiV believed that he wasn't going to be able to adhere to the medical guidance, because if you miss your bi-monthly injection, then there is quite a significant risk of developing resistance to the drug. I think our argument really was that there is a greater risk, in our opinion, of him actually contracting HIV and not being able to adhere to medical guidance once he's actually HIV positive. So in our opinion, that's the greater risk, but we're in the process of appealing it, and hopefully having spoken to a representative of ViiV here who has been sort of giving me quite a lot of information, things are looking much more positive in terms of injectable PrEP being rolled out in the UK. So we are making progress. Just quickly, I think that something that we find in our service, and again, don't want to say that this is representative of kind of, cis female sex workers in general, but there does seem to be a gap between GBMSM and trans community, trans sex workers, and then cis female sex workers in terms of kind of openness and kind of understanding around PrEP. From within our service, my role was created because our commissioners identified a low number of cis female sex workers who were actually on PrEP, and we wanted to try and work out why that was, and so we conducted some interviews, and we found that the vast majority, 94% of the cis female sex workers that we interviewed were not taking PrEP. 47% hadn't heard of it. 80% either identified basically saying that they didn't want to take a daily pill every day, didn't want to have to factor that in, or they just sort of weren't sure about it, so it just demonstrated a kind of a lack of knowledge and understanding around it. And we've also anecdotally just heard, when I've had conversations with the clients in our service, it's a lot of the time it's, I didn't realize that I could take PrEP, or, I thought that PrEP was just for gay men. So that's sort of, it's clear that we need to try and improve the understanding and knowledge around that in order to try and reduce that gap. And we are making progress, but it is slow going. I just wanted to kind of summarize with some final thoughts around it. I think it's clear that there needs to be more work done around raising awareness of PrEP, and I think I forgot to mention that another kind of thing that's been discussed so far by a few people, I think, has been concerns around stigma and shame when it comes to PrEP, and obviously sex workers having PrEP medication at home and having the fear that that punters are going to see that and they're going to think, oh, that's HIV medication, someone's on HIV, and so there's a sort of slight resistance to that as well, and that would just goes to show just how much the injection would actually improve the situation, because that would just take away a lot of the potential for shame and stigma around that as well. And yeah, I think it's clear that that having the injection as an option would be massively beneficial to all sex workers, and particularly some of the sort of, examples that I've highlighted, sex workers who are in particularly precarious situations in terms of homelessness and addiction and mental health issues where that just isn't an option. But their progress is being made, and hopefully we're going to see injectable PrEP rolled out across Europe, the UK, and the rest of the world very soon. Thank you.
Thank you very much, Ed. Now we would like to introduce Guilhem, who will tell us about access to PrEP for undocumented sex workers, men who have sex with men, and trans sex workers. And actually the benefit of having Guilhem here is as well that Guilhem will tell us the contextual knowledge share with us the contextual knowledge about the situation here in Belgium.
Thank you. How does it work? Hi.
Do you have a presentation?
I do have a presentation, a few slides. Hi, everyone. Thank you very much for having us. Thank you, ESWA. Thank you, Luca. I am not a sex worker. I am a director of Alias, which is an organization that has been providing and helping sex workers for the last 15 years here in Brussels. We're literally a block away from here. I'm really, really humbled and honored to be able to talk to you today about what we're doing. I have my notes right here. So also the project and work I'm going to present today is not at all my work. I'm one to present, but it's the work of an entire team, and like shout out to them for doing most of the work. So yes, that's what I'm going to talk about. I misspelled my own name, which is the sign of my title, and it's only Tuesday, it's fine. Yeah, quick word about Alias. That's what we're trying to do. That's the kind of service we're providing for MSM and trans people concerned by sex work here in Brussels. There is absolutely no condition, free, anonymous services, and that's about the thing we're trying to provide. And most of them for the last 15 years here in Brussels. One of the things that I've focused and the services that this project is out is our medical consultation. So we have once a week free anonymous medical consultation in the evening. The hours and the organization of this medical consultation has been changing with the community feedback that we had. But now it's once a week, and we have 2 doctors at the same time, and we like to have 2 doctors at the same time because it means that if there's a lot of people, and if one of the doctor needs to take extra time with you, he can take extra time, and the other doctor can keep seeing people, because we have every week a lot of people that come and want to be tested or get information about PrEP or get information about this little worry they have about their body, that little thing that's, we all had a little concern about our sex health. And from that medical consultation came a lot of time, and many, many, many times, question about access to PrEP. I'm undocumented, I'm here in Brussels, how do I access to PrEP? Belgium has, in theory, and that's the problem, in theory, a very accessible way and very free and universal access to healthcare for everyone, even for undocumented people. That's the theory. Practically, and especially in Brussels, it's horrible administrative maze you have to face. There's 19 districts here in Brussels who have 19 different ways to access PrEP for undocumented people. Every single commune, every single district can implement different ways of doing it, and most of the time people have to face many thresholds that are, I mean, the usuals. You have to speak French or Dutch, you have to be on time at the appointment, you have to be polite and say hi and not be aggressive or not be perceived as aggressive. Of course, all the things that will put people away from public services are indeed implemented in those so-called universal access to healthcare. What we've known and what we've seen that, of course, all those formalities are just discriminating more people that are already discriminated, and as a result of that, the most discriminated people that are indeed facing the more risk are facing more threshold to access PrEP. To access healthcare, and so to have PrEP being reimbursed. If I'm lucky, I'm undocumented. I mean, if I'm in the lucky part of the people that are undocumented, not that it's a lucky situation, but if you go through the whole administrative thing and you finally get your AMU, it means that you can go to a doctor, get your PrEP prescribed, and then get it. In Brussels, it will have to be the first appointment will be at the hospital, at infection department services for the first prescription of PrEP, and then you can have it through a general practitioner. This, for us, was one more threshold that we have to tackle in order for people to have better access to PrEP. So I would say that everything there, yes. Yeah. And then comes our lovely partner, which is Saint-Pierre Hospital. And this shows, like, my point of naming that hospital is also to show that it's just a matter of finding the nice institution. We're lucky in Brussels because we have this hospital that has a good history of willing to be a real public hospital and being open to vulnerable people. They've been working through that, and they're very, very listening. And they're really helpful. In other cities in Belgium, it's not been the case. It's not the case necessarily in Antwerp, it's not the case in Ghent, it's not the case in Charleroi or Liège. Even, I don't know if my colleague from ESWA is still there, but she could tell you about it. When I talk about precious partnership, it's because we had long-term relationship with this hospital that they were able to listen and to understand. That's because we've been trying to send people to this hospital for many years, that they've learned little by little about the feedback that we're making them. You know, like when we had trans people coming back from the hospital and telling us, like, no, that was not okay. The way I was welcomed was not okay. This place is not safe. We were able to go back to them. And it takes years. I mean, you probably know that, for public institution to learn and to listen. So this partnership is precious to us. It's the result of a long-term relationship. And we've been learning from each other. They've been calling us, telling us, oh, there's not new molecule, there's not new medicine. Now we're not treating the same way syphilis and gonorrhea because of antibiotic resistance or stuff like that. And they've been learning from us, you know, like trying to reduce the stigma around sex workers when we recommend sex workers to go there. So, where am I? Yes, not yet. The idea of this project was to create a shortcut to be able to have undocumented sex worker not to have to go through the whole administrative maze and be able to just go from Alias to a doctor and get their box of PrEP without any paperwork. Because they don't have time for this. They need to being able to keep working safely. So that's what we did. We kind of negotiate with our funding administration that we could give some of the money we get directly to the hospital. The hospital would buy literally a stack of PrEP for us and keep it somewhere. So whenever we have someone, it sees a doctor at Alias, get tested at Alias. If the result for HIV are negative, which is literally the only condition you can have access to PrEP, with a few little exam. I'm not going into the kidney function and stuff like that, but you run through a few tests, you can have access to PrEP if you're HIV negative. People would leave Alias with a little paper from us, and we're a doctor, they go to Saint-Pierre, they get their box, and that's it. And then we'll start the administrative bullshit thing they have to go through to finally being able, maybe a month or 2 months later, to have access to PrEP through the normal administrative thing. And that's our point in this project, is to advocate for this idea of treatment first. And we really believe that treatment should be first, and whatever administrative road and whatever paperwork that people have to go through should be taken care after. And such important and efficient treatment as PrEP is, it literally just takes a test, a negative test, and if you can function result and you can be under PrEP, it should be easy and fast. And the work and administrative work should be on organization like ours, on hospitals, on administrative, not on a person that already has to been through a lot of crap because he's a migrant, he's undocumented, he's a sex worker, he's at risk of many things, he's using drugs, maybe he has mental health issues. I mean, I'm not going to teach anyone about that here. Then we said, okay, we have to talk about that. So we wrote a research with the Institute of Tropical Medicine of Antwerp and the other organization that work in the north part, the Flanders, the Dutch-speaking part of the country, which are Violet, and the French-speaking part of the country, Wallonia, is Espace B. All three organizations and a researcher from the Tropical Institute, we made that research. We made a policy brief saying, like, okay, we need to improve sex worker access to PrEP. It has to be easy, it has to be quick, because the prevalence numbers are frightening. I mean, you see that red bar here? That's the prevalence HIV for transgender sex workers in Belgium. That's just insane, and it should be alarming for everyone. 17. I mean, yes. And it worked. I mean, almost. We got money. We got a nice speech and a nice article from the Ministry of Health last year that says that he's going to give money. He's going to give €1 million to facilitate PrEP access to sex workers. Well, it's been a year that he said that, and we're still waiting for that money. So we're still hoping. It's like there's still 26 days left in December. So maybe we get that money before the end of the year. I doubt it. But we keep shaking them and asking them. The thing that we learned from that experience is what I said earlier, is treatment first. And I think that's something every social, medical, or ally organization should advocate when it comes to PrEP, when it comes to ARV. It's just treatment first. It doesn't matter where you're from, what kind of paper you got, what situation you're in. You come, you get your PrEP, and then we talk paper, and then we talk administrative things. Yeah, also, if you're here for a couple of days and you're MSM or transgender sex worker and you need anything, we're literally right in one corner. Come to me, maybe we can help. Thank you very much.
Thank you so much, Guillaume. And right now we will have a chance to meet Benjamin, who is in Zurich right now, and who will talk about improving access and continuation of PrEP for highly mobile sex workers in Europe. And since Benjamin, as Luca said before, is very busy, he actually recorded the videos for us, and Laszlo will play the video.
Hello, everyone.
Discuss issues around PrEP while having lunch.
Hello, everyone. I'm really sorry that I can't be with you today. This is really sad because since the last year I started to work with ESWA, there were some really amazing meetings and some great people that I met in the last 12 months. So shout out to all of you. My name is Ben Hampel. I'm an infectionologist. I'm a medical doctor, but also researcher, and I run the PrEP study and program here in Switzerland, and I'm based in Zurich. Together with ESWA, we're working on a project where we want to improve the situation for highly mobile sex workers who work in different cities. So I have some slides prepared that I want to share with you. This is just a quick overview of our idea. And of course, if you have more questions, please contact me. My email address is in the last slide. So what is the background? So in my clinic here in Zurich, I work in Checkpoint in Zurich. We saw more and more sex workers who started PrEP actually, but had to stop because they didn't know where to have access when they traveled and were working in different cities. So this is kind of sad because we see people were already ready to take PrEP and protect themselves with PrEP for HIV. But then didn't have access or didn't know where to get it from. And this is something we see all over Europe. If I talk with my colleagues from Barcelona, Madrid, Berlin, Brussels, we see this everywhere. So there's one already great activity from the PrEPsters group or Laughing group. It's the Queer Health Info, Queers Beyond Borders. This is a guide through cities in Europe, not only where you can get PrEP, also for trans people, where to get hormones and other very important informations that you might need. So keep that in mind. So what have we done? We started with a workshop together with ESWA in Porto in May this year, where we finished our year, and we also made a conference with 6 community-led health centers all over Europe. And everyone agreed that this is a program that we need. We also explained the idea in a meeting in the European HIV conference in Warsaw in October 2 months ago, together with ESWA. And we saw, when we talked about people in the community, but also with healthcare providers, we see in this group, we see actually 2 problems. One is access to the medication and the checks you need if you're on PrEP. But also for us, as the doctors or nurses, very often we don't have access to the files, so we don't know if the person is vaccinated against hepatitis B. We don't know how the kidney levels are. So this is always a kind of a bummer, and we call the other centers, and it's very difficult to get the medical information between A and B. So, and if we look a little bit in the future, what PrEP will be, so we just have the European label for cabotegravir, which is a long-acting PrEP. This is not a daily pill; it's an injection that you can get, and you need to take it every 2 months. The problem is if you stop it, you are on very high risk in the time after you stopped it. If you then contract HIV, to also create resistance against the integrase inhibitor, which is the group of HIV medication which this PrEP is about. And then if you then get HIV, it might be very difficult to get treated. So with the future treatments, it might be even more important that sex workers have access and for a continuation in their PrEP care, even if they travel around Europe. So what do I do in Switzerland? And we thought this might be a role model for some of the problems. So we created a Swiss Prepared program and study. And in this program, we have an online consultation tool. So people come to us, fill out a questionnaire at home. And when they come to us as healthcare professionals, we already have the very important information about side effects, how often the people took the medication, if there are any problems occurred, if there are symptoms of an STI. And in the program, we also train healthcare professionals regularly in how to speak about sex and how to prescribe PrEP. We created guidelines, and we have a very, very low threshold access to PrEP for people who are on the program. With this questionnaire, of course, we generate a lot of data, and we ask all the people who are on the program if they are willing to share this data. And with this data, we could actually already made some very great programs. And for example, we have one We have one PrEP clinic now in the red light district where sex workers can come as a walk-in and don't need an appointment. And we do an HIV rapid test. If this is negative, they can start PrEP in 20 minutes. And this was only possible because within the study data, we could see that it's safe and the sex workers come back to their appointments, and that made a really great program with this. So how does this work? This is the questionnaire, people fill it out, and then the healthcare professionals, as we do, as doctors and nurses, we never have time. We get a very quick summary of this very important information. And the cool thing is also, we have now 41 centers all over Switzerland. And when someone wants to switch between the centers, they take this information of the questionnaires with them. So then we also have the information which is stored anonymously, only with your ID number, and the participants have their ID number. So I can go to Geneva, for example, show my ID number, which is on my phone, which I get sent by a text message, and say, hey, I want to switch to you. Can you do my PrEP consultation today? And then the participant gets a text message, says, hey, the center in Geneva wants to have your file with the information. Is that okay? And if you say yes, that's okay, you can click yes. And then the new center has access to it. So it's very convenient. You can do this in 3 seconds when you stand in the intake, and you don't have to call the other centers to get the information. And it's still the person, the PrEP user, who is in charge of who has the information and not. So could this be a role model for Europe? That's what we want to do. So we have now several organizations that we work together with, especially based in Barcelona, in Brussels, in Berlin, in Milano, in Zurich, of course. We hope also to find some cooperation partners in the Eastern Europe. So this will be the first start that we hopefully could start in a few months. And then we hope we can spread it all over Europe, but maybe also even for other countries, because sex workers also work outside of Europe sometimes. So, but that would be a first start. So the challenge that we have now at the moment, that very often a lot of like more research oriented centers approaches, like university hospitals, with like, well, I'm sorry, but you're not very often the center sex workers like to go. So I really need your information. Where do you like to go in your hometown? Which is a sex worker friendly place where it's prescribed PrEP? Hello, everyone. I'm really also work outside of Europe sometimes. So, but that would be a first start. So the challenge that we have now at the moment, that very often a lot of like more research oriented centers approaches, like university hospitals, with like, well, I'm sorry, but you're not very often the center sex workers like to go. So I really need your information. Where do you like to go in your hometown, which is a sex worker friendly place where it's prescribed PrEP? That's something. Please send me this information if you have it. Of course, we are in different countries. We have different regulations for data security. That's a huge problem we have to work around. Of course, we're not limited to Europe. Language is a problem. The good thing is in Switzerland, we already have 3 languages, and we also have English included. So I think one very important step will be French and maybe also Portuguese, and then go from there onwards. And then one thing we realize is sex workers sometimes like to change their telephone number very often. So that's something we have to work on. And of course, trust is very important. So this is and that's something that we really worked hard on, that the data is anonymously and secure. But of course, you need to understand it and have critical questions before you give someone your data. So we are still looking for cooperation partners, but we have already scheduled a meeting in the beginning of next year. And the next step, of course, will always be looking for money. That's my job. If you have any questions or input to this project, please don't hesitate to contact me. If this is too fast now, also ask Luca to give me my email address to everyone who needs it. And I'm really sorry I can't be in this meeting. Okay, thanks, bye.
Well, thank you so much. I hope that was an interesting session for you. Please talk to the panelists if you have any questions. Really do contact Ben. The project that Ben is leading to have a network of checkpoints and experts to access PrEP for migrants, sex workers in Europe is really important, and we want to collaborate on this. Just a couple of points to close. Agatha was mentioning that our research on PrEP is going to be launched in February. That's not true. We are late with it, and it will be launched at a later date. We're still working on it, but we will have a European launch and then national launch with the organization that were part of the project. So keep an eye out on this. And in particular, if your organization or institution wants to work on access to PrEP, contact us and we can organize a launch with you at your university, your checkpoint, your service provider. It will be available in English and in around 6-8 languages. Ben mentioned. And then the final thing around injectable PrEP, there is currently a survey that is being led by Maastricht University, also supported by VIV, that looks at people's perception of injectable PrEP. I will send the link in the WhatsApp group and by email. And I do think it's quite important that sex workers respond to these surveys, because what Guilhem was mentioning, around data prevalence around trans sex workers, is that data is missing when it comes to our community. Even male sex workers fall into MSM, trans sex workers potentially in trans community, but actually sex workers themselves are rarely recognized, and the prevalence is less identified, and it's harder to develop good program and policies. So that's all for us. Thank you so much, Agatha, for chairing, and all the panelists, and Laszlo again. And we caught up our delay. So now lunch is on the first floor. It's a 3-course meal. And I don't know who are the meals, but apparently they are delicious. So see you there.
you.